Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 311 of the Ask Dr. Angela podcast. It is Sunday. I'm actually podcasting on a Sunday. I don't feel like that happens very often. But anyway, it's Sunday. It's like overcast outside. I've had a pretty eventful morning. I actually got up this morning, grabbed my cup of joe, which for me is a grande soy caramel macchiato. They know me at Starbucks and actually gave me my drink on the house this morning. So we got off to a great start. I drove to Tom's River this morning to pick up some Italian cookies, actually. I have such a sweet tooth. I love sweets. I trucked all the way down to Tom's River to pick up some Italian cookies, and they were actually really quite delicious. I came home only to find some tulips, a bundle of tulips left at my mailbox, and they were gorgeous. I was so appreciative for a couple of reasons. Number one, I love fresh flowers. I keep fresh flowers throughout my house. It adds life, color, and, flowers just make me happy. They smell really good. The second reason I was really happy about this drop-off at my house was I was in need of some fresh flowers. With everything going on, i.e. the pandemic, I don't feel like my usual go-tos have had the best assortment available. I usually will grab some flowers, when I'm at the grocery store, which is usually like Wegmans or something like that. So my tulips are really, really, really beautiful. So you all know that I do a lot of queries and I get a lot of features in all kinds of journals, magazines, online publications. And I recently was going through some of the features that I've gotten, and I came across this one from Romper, and it was actually featured in, I want to say, March. I'm just, again, going through some things in all of my files. And I thought it was a really good one. So they reached out to me and they said, Dr. Angela, can you give us a list of 3 to 5 issues that you think doctors tend to overlook in women and why you think this might happen? And I thought, oh my gosh, that's actually a really good question. So what I came up with them were 3 things immediately came to mind. Number 1, mental wellness. And what I mean by mental wellness is it has to do with women's emotional well-being, stress and how we're coping with that. And how we as women cope with things like depression, anxiety, etc. There's such a stigma around mental wellness and mental health. And I think that sometimes, even as physicians, people can be really kind of uncomfortable broaching this topic or even addressing it. So mental wellness is number 1. Number 2, lifestyle. Anyone that knows me knows that I am a huge lifestyle advocate. I always ask you about, how is your diet? How active are you? I don't believe in dieting because eating healthy and being well are things that we are supposed to be doing. These are things that we should be doing on a very regular basis. So with regards to lifestyle, I will always inquire about your eating habits, what you're eating, and what kind of exercise you're doing. It's really important to make sure that women are taking time out for themselves, ourselves, because in most instances, women are like running the show. We are the ones that are holding it down. And last but not least, the other issues that I sometimes feel that we as physicians tend to overlook in women, pain. Whether it be due to, menstrual cramps, pain during sex, or pain of some other etiology. Why do I think we ignore this? Maybe because sometimes we just don't know what the cause is. But as physicians, it's our job to, inquire. And certainly in my practice, I do a very thorough history and a very, focused exam. And certainly if I feel that it's outside the realm of what I do. It's certainly my aim to be able to point someone in the right direction. So 3 to 5 things. I just gave you 3 things that I think doctors often overlook in women: mental wellness, lifestyle, and pain. Again, the reasons that these things can be overlooked are twofold. Women sometimes tend to not be as forthcoming about these topics due to, an uncertainty about how to bring it up. They might be embarrassed, or they might even think it's normal. I have a ton of women that have horrendous menstrual cramps and they just think that that's how it's supposed to be. Not. Or, you might have pain during sex and think, oh, this is just part of being a woman. Not. So, those are, a few of the reasons why these can be overlooked. Secondly, again, physicians might be uncomfortable talking about what might be viewed as, quote unquote, a sensitive topic. So, these are just kind of things for food for thought. Another part of the query that they asked me was, what do I suggest for women who feel like their health concerns aren't being taken seriously? That's very easy for me. I think I've shared before that, one of the main reasons that women give for seeing me as a new patient is that their previous physician didn't address their concerns or take them seriously. You can address that one of 2 ways if you feel that you're not being taken seriously. You can either have a heart-to-heart with your physician and tell them your concerns and see if it makes a difference, or you can see someone else. I tell women all the time that they, i.e. you, are the biggest piece of your health care. And if you don't feel like your needs are being adequately addressed, you need to find someone who will address your needs and provide you with the care that you certainly deserve. Again, I see new patients all the time, and I always ask, how is it that I have the pleasure and privilege of seeing you and providing you care today? And really, one of the main reasons they give me is my previous GYN or physician. I didn't feel like they listened to me. I didn't feel like they heard me. I didn't feel like they were taking me seriously. So I thought this was a really good piece to share. It is featured on Romper's website if you're interested. But otherwise, good topic, and hopefully this promotes some sort of discussion if you feel that you are someone who isn't being taken seriously. Thank you so much for tuning into today's podcast. Hopefully you've gotten something out of it. For those of you who don't know me, I'm Dr. Angela, everyone's favorite OBGYN. You can follow me on any of my social media platforms. I'm on Instagram, Facebook, Twitter. You can shout me out. Follow me at www.askdrangela.com. That's AskDrangela.com. There you can sign up for my podcast, my weekly blog posts, and again, you have access to me on any of my social media outlets, which are again featured on the website. I always give you some sort of little quote from an inspirational book. This one is coming to you from my Congratulations Graduate book. I got this actually, I think when I graduated, it might have been high school or college. This book is old. But anyway, I like this quote this is Robert Frost actually, and it says, "In 3 words, I can sum up everything I've learned about life. It goes on." It certainly does. Thank you so much for tuning in to today's episode. I cannot wait to reconnect on episode 312. Until next time, choose happiness. See you soon.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.